Thank you. Good afternoon, everyone. I am Salsabil from Tunisia. I'm going to present the first part of the National Point-Prevalence Survey of Healthcare-Associated Infections in Tunisia, according to the study NOSOTUN 2012. According to the CDC definition, healthcare-associated infections are defined as infections that patients acquire during the course of receiving treatment for other conditions within a healthcare setting. Healthcare-associated infections are a major public health care problem worldwide and a real threat to the safety of care because of their magnitude, their severity, and the additional costs they generate. In Tunisia, were conducted two surveys of healthcare-associated infections. The first one was conducted in 2005, with a national prevalence of 6.6%, and the second one is the one I'm going to talk about today, is NOSOTUN 2012. The main objective of our study is to determine in healthcare institutions of Tunisia on a given day the prevalence of healthcare-associated infections and describe them by type of healthcare facility, service, and infectious sites. Methods. Our study is a national point prevalence survey, duration from the 5th November to the 8th December 2012, among 144 healthcare facilities. Our study was proposed to all university hospitals, all regional hospitals, and military hospitals in Tunisia, and also for all private clinics. Our study includes a stratified sample of district hospitals. Were included in the survey all hospitalized patients for at least 48 hours on the day of the survey, according to the CDC definitions we saw in the previous slide. Were excluded from this survey short-stay services less than 48 hours, such as peripheral maternities, hemodialysis centers, etc. For the site infection definitions, we were based on the criteria of the French National Technical Committee of Nosocomial Infections. For the surgical site infection, we were based on the CDC definition. Data collection and analysis. Data were collected using three paper-based standardized questionnaires: the paper establishment, paper service, and the paper patient. For the first paper, establishment, it provides data about the type of healthcare facility, if it's a university hospital, a regional hospital, or district hospital. For the legal status, which means private or public healthcare facility, and the total number of beds. For the service paper, it provides data about specialty of the service, medical or surgical or intensive care units, and the number of beds in each service. For the patient paper, it provides data about age, sex, medical history, invasive devices, antimicrobial treatment if the patient is under antimicrobial treatment, and the antibacterial susceptibility testing. For the ethical considerations, anonymity for each patient is guaranteed. Each patient was given a unique identifier while data entry. For the data analysis, we used the software SPSS20, and the proportions were calculated with chi-square test. For the results, the figure 1 shows the distribution of participating healthcare facility. Almost 40% of healthcare facility participating were private clinics. We have 52 private clinics participating. For the regional hospitals, almost 32 regional hospitals. For the district hospitals, 28. University hospitals, 24. And only one military hospital. For the characteristics of the surveyed patients, 8,649 patients were included in the survey. 50.8% were male patients. The median age was 47 years, with a range from 0 to 105. The figure 2 shows the distributions of participating patients by specialty. 51% of participating patients were from medical services, 34.5% were from surgical services, and 14.5% were from intensive care units. Over these 8,649 included, 575 patients had one or more active healthcare-associated infections, which makes a national prevalence of 6.6%, with a confidence interval between 6.2 and 7.2%. If you want to consider the total number of healthcare-associated infections recorded the day of the survey, we have 662 healthcare-associated infections, which makes a global prevalence of 7.8%, with a confidence interval between 7.1 and 8.2%. The figure 3 shows the distribution of most reported infectious sites in our study. In the first place, we have the respiratory tract infection, followed by the urinary tract infection, then the bloodstream infections. The prevalence of healthcare-associated infections by sex shows that among male, we have higher prevalence, 8%. Among female, it was 5%, with a significant difference between sex. For the prevalence of healthcare-associated infections by type of healthcare facility, the prevalence among private healthcare facilities was almost 10%. Among public healthcare facilities, it was 6.2%. With a significant difference between private and public, the ratio of prevalence is 1.64, with a confidence interval between 1.3 and 2.06. The figure 6 shows the prevalence of healthcare-associated infections by age group. The most affected age group by healthcare-associated infection is the first one, age under 1 year, almost 11%, so followed by the age group between 5 and 15 years, pediatric services. Then the third age group most affected is over than 65 years. For the prevalence of healthcare-associated infections by specialty, in the first place, we found that intensive care units have the highest prevalence of healthcare-associated infections. Almost 30% of hospitalized patients in these services had healthcare-associated infection the day of the survey. In the second place, we have versatile services, which are services of private clinics, including patients from different specialties, medical and surgical specialties. In the third place, we have pediatric services, then medical services, surgical services, and in the last place, we have the gynecology services. Discussion. If we want to compare the results of our study to the previous national point prevalence study in 2005, we have in this study 134 healthcare facilities participating, while in 2005 it was 66 healthcare facilities. We have a better participation in this survey of private healthcare facilities, 52 vs 12 in the previous survey. We have almost the same national prevalence of healthcare-associated infections. We have almost same prevalences in public and private healthcare facilities. We have always the highest prevalence in private healthcare facilities. The highest prevalence in 2005 was recorded in hematology services, 23.5%, and then in intensive care units. We have the same infectious sites, urinary, respiratory, and bloodstream infections. If we want to compare our results to the European hospital results in 2005, we found that in Tunisia we have higher healthcare-associated infection prevalence. In European hospital, it was 5.7%, with a confidence interval between 4.5 and 7.4%. For the main limitations of our study was proposed to all healthcare facilities in Tunisia, but it is still a voluntary participation. We had 144 healthcare facilities participating among 242 healthcare facilities in Tunisia. Since it's a cross-sectional study, we have an underestimation of healthcare prevalence in surgical services. As a conclusion, this point prevalence national survey allows to have a new baseline data. The main messages to take off is that the prevalence in Tunisia of healthcare-associated infections is high, 6.6%. The age groups at risk are inferior to 1 year, between 5 and 15, and over than 65 years. The services at risk are intensive care units, pediatric services, and the healthcare institutions at risk, private especially private healthcare facilities. According to the results of this survey, the main recommendations to give is to strengthen hygiene measures by training on standard and additional precautions for the medical and paramedical staff, build capacity of infection control evaluation, and implement a reporting surveillance system of healthcare-associated infections in healthcare facilities and services at risk, especially in private healthcare facility, intensive care unit, and neonatology. Thank you.
Thank you very much, Liliana. So, if we have any question, please.
Thank you, Tunisia, for your presentation. Just a small comment. Your study you are doing in December. In December, you are doing this study.
It was 1 day.
1 day.
For each services, 1 week for the establishment, and 1 month for the whole country.
In December?
Between 5 November and 8 December 2012.
12. Just small comment, because I know in Tunisia is like when December you have a lot of cases for influenza, because it's the peak, because you have the close.
Okay.
It's cold. This factor when you have influenza, this is not influenza your study because you have a lot of cases for infection respiratory.
Yes, it may be, yes. It may be, and especially that we found the highest prevalence is intensive care units. It may be related to the clinical, that it may be for the invasive devices, because patient hospitalized in intensive care unit may be under mechanical ventilation and intubation. Okay, thank you.
Okay, thank you for your presentation. It's a very interesting study that had been done. Actually, my friend told me that we should do such in Palestine. Actually, my question was, can you explain, or did you have any explanation why you, in the study, that the private sector had more than public sector, the healthcare association problem, once it's the opposite, what is in our beliefs, that the public sector is more. So
yes.
It's one, and also the age group, you said that it's more in children rather than in elderly, and we know that nowadays we are fighting against NCDs, and that we know that the occupation in the hospitals are more with NCDs. They are being in hospitals more times rather than children. So we expect that the healthcare situation problem will be more in elderly than in children. But in your study, it's the opposite.
Will be more? We expected that?
Yes, because
it will be more in each services? Which one?
Because they are using the healthcare services more elderly than children. But in your study, you show that it's the opposite. In children, the problem is more than in elderly.
Yes. For the
is there an explanation?
Yes. For the first question, is that we have a higher prevalence of healthcare-associated infections in private healthcare facilities. In Tunisia, it's known that it's opposite. In the private, it's more, yes. We do believe that it's because of the lack of hygiene. We don't have an evaluation of professional practices. That's why we have higher in private healthcare facilities. And for the second question, is that because the median age in our study is 47 years. We have a relatively long population of study. That's why we found the higher number in this for this age group, inferior to 1 and between 5 to 15. Okay. Thank you.
Thank you very much for this nice presentation. This is a philosophical question. How far can hospitals be transparent in reporting their hospital-acquired infections?
We cannot be sure of their. We cannot be sure. We proposed this study to all hospitals. All university hospital participates, all regional hospital participates, but for the private clinic especially, we can't be sure that they are transparent towards us. Thank you.
thank you for the presentation. So to come back to the difference between the private sector, what is, I think, quite surprising, but unless in Tunisia it's not like this, but usually in Europe, in the private sector, all the services that involve invasive procedure, usually they don't happen in the private sector because it's not cost effective, it's not... it doesn't bring money, so it's surprising. I don't know how it is in Tunisia. Do you have exactly the same kind of service in the private sector and the public, or
for we can attribute this to the invasive devices.
Yes. They have intensive care unit, they have surgery, which any kind of operation.
Surgical services,
it doesn't matter. They do exactly the same.
Yes.
Thank you.
Question.
I'm sorry to go back to the same theme about the discrepancy between the private and the public sector. Do you think it might be because of the selection bias? Maybe the public hospitals participating in the study were the ones that were kind of better
maybe,
in this kind of...
Yes, because for the public, they also participated to the study. But for the private clinics, we proposed to all clinics, and 52 participated over 75 clinics.
So you had higher participation rate among the private?
Yes.
Okay.
Okay.
Thank you.
Okay.
Okay. Thank you for your presentation. I'd like to ask about did you put definition for healthcare associated infections, especially that patients who go to private clinics sometimes go for 1 day. How can he got infection and you are making your survey in the same day? If you would like to know the infection is coming from this health facility, it's better to ask him after taking services in this health facility. So what is your definition of healthcare associated infection?
The definition I put in
used in this survey. Okay.
This one. This is the definition. For the infections that patient acquired during the course of receiving treatment, and for when the investigator passes in the services, they selected patients who were there for at least 84 hours.
84 hours from when?
From the admission to the service.
Admission?
From the admission, yes.
You only take the admitted patients. Admitted.
Yes. Admitted in the service.
Yeah.
When the investigator passes, they ask the patients, have you been there for how much time? Have you been there for at least or for more than 48 hours?
What is the demarcation?
Or excluded the short stay services.
Yeah. How can you differentiate between infections occurred during the health facility and the appearing of new symptoms and signs of the original disease? Sometimes the patient may go with milder form of symptoms and signs, and when he be admitted to the hospital, may show some more complicated signs and symptoms. How can you differentiate this?
How can't we confuse between the main diagnostic and healthcare associated infections?
Yeah.
We ask them when you were admitted in this service, had you this infections at home, or it was developed while you were in the hospital?
You ask the patient?
Yes.
Okay.
We are out of the time. You have a question? Okay, last question. Okay.
Just a comment, because I'm conducting the same study in Macedonia, and for such questions, I need to ask the doctor. Do you think this is an intra-hospital infection? And we have to clarify that it is maybe through the endogen bacteria, but it is intra-hospital. There is a definition. If the patient has been in the hospital more than 48 hours, and after that he conducts an infection, it is intra-hospital. This is a definition for the protocol. And it is endogen or coming from another, there are some sub-classifying definition or so, but it is intra-hospital. So we have to summarize like intra-hospital.
Thank you.
Thank you. Congratulations for your presentation.
Yeah,
Thank you very much. I think we can continue the conversation later because it's fascinating. But thank you, and I think we can. We still have another.